We're going to have fun today on The Girls. We are in Scranton, Pennsylvania at Lackawanna Medical Group, and we're going to talk about cosmetic procedures.
Yeah, we're going to turn back the time on your face, on aging, and maybe if you'd like to prevent and also to correct.
Yes, and we are here with a nurse practitioner. We have Amanda Grippo with us. And Amanda, thanks for having us into the practice. I know that you're located inside Luzerne, I should say the Lackawanna Medical Group.
Correct.
Okay.
So it's LMG Cosmetics, and we are inside Lackawanna Medical Group, and we do offer cosmetic injectable procedures.
All right.
We use Botox for the prevention and maintenance of fine lines and wrinkles, and we also offer dermal fillers.
All right. What is your background, your qualifications?
So I was an RN, and I worked as a nurse for about 5 years while I was in school getting my master's as a nurse practitioner. I do gastroenterology as well as a little bit of family practice, internal medicine, and then just recently, within the past few years, started doing some aesthetics with cosmetic injectables. Some of the areas of the face that we inject the upper third of the face with Botox, and we do the mid-face for mid-face volume loss, as well as the lower face with dermal fillers. We inject the lips, smile lines, or as patients will call them, parentheses lines. We can do the chin, kind of sculpt the jaw, and we can also get rid of your double chin. We have a procedure that we like to call Kybella. And that I like to call it a fat dissolver or liposuction in a syringe.
Oh, nice.
Yeah, so that's fun.
Before we get to some of the procedures that you're going to see here today, let's talk about safety. Are the items clearly that you're putting into your body, are they safe for your body?
Yes, they are all FDA approved injectables. Botox obviously is a neurotoxin and very, very safe for injecting for fine lines and wrinkles, as well as Juvederm. Juvederm is a natural product. It is sugar and water. It's actually composed of hyaluronic acid, which is a natural product that is found in our body. It's found in our bones. It's found in our skin. It's what makes us look beautiful. When we inject it into our skin, it actually just lifts and hydrates. So patients should not have a reaction to it, should not be allergic, because it's already naturally found in our bodies.
How long would something like that last if someone were to have that? Is it that it's going to last for a year or 6 months? How long?
I always like to tell our patients different products for different parts of the face last different amounts of time, but realistically around 6 months to up to 2 years some of the fillers last.
And if someone is watching and they're thinking about getting these procedures, because many people reach out to us because we're on television and they ask us genuine questions. Is it safe? Who do I go to? What do I look for when I'm going to someone to get these procedures done? What should they be looking for if they're interested in, getting something done to their face?
Well, you definitely want to make sure you're doing your research, because you want to go to an experienced injector, someone who's been injecting for a long time. Patients will think, or clients, I should say, potential clients, I want to go to the best plastic surgeon that I could find, or the best, I want to go to a physician, a dermatologist. However, sometimes, plastic surgeons, they're good at what they're good at. They're good at plastic surgery, breast augmentations, facelifts, etc. So even if someone such as myself is a nurse practitioner or even an RN, some of the best injectors in the country are registered nurses and nurse practitioners. I just always like to say this particular field is my calling. I love it. I love anything to do with makeup, skincare. You have to know the facial anatomy. You have to be very safe. You have to know all the areas of the face, red flag area, different locations, where not to inject, danger zones, etc. But you also want someone who knows what looks good, who knows what...
And will tell you the truth as well.
Exactly.
It's kind of like hair. You can go to someone to do your hair and say you want one thing, and they might say, whoa, that is really not going to be good for your skin type or for your hair type.
Exactly.
All right, well, I'm getting excited about all this,
Yay!
so I'm sure the audience out there watching is as well. Stay with us, because when we come back, we're going to see 2 procedures that are done right here today on The Girls.
Hey guys, we're at LMG Cosmetics, and we are going to show you some cosmetic procedures here on The Girls.
I'm excited. I can't wait to see something done like this, like right in person. So we have our guest here, Sierra, and she joined us. And are you excited, Sierra?
I am. I am.
Is this the first time you've had a procedure done?
I've had my lips, but I've never had Botox before.
All righty. Well, we're going to ask what's going to be done today. You know, your face looks absolutely perfect to me. So you're very young and you don't have any lines at all on your face. So what's the purpose of this procedure today?
So obviously Sierra is very young. She's 28 years old and she has virtually no lines and wrinkles right now. There are no etched in static lines on Sierra's face right now, which is a great thing. However, we want to prevent those fine lines and wrinkles from forming. So we are going to be doing a little bit of Botox in her forehead. So I'm going to have Sierra frown for me. Pull the eyebrows in. Yes, perfect. So when she frowns, she creates those what are called 11 signs that patients will call it. And when we put a little bit of Botox in, it relaxes those muscles and prevents her from making that scowl face. As we age, unfortunately, the word that we hate, we start to lose collagen and elastin in our face when we're young. When we make those frown lines, the skin just kind of retracts back. But as we get older, those lines just eventually start settling in as we lose collagen. So Botox helps with that.
And it's really a personal decision to make, just like if you want to have your hair go gray or you want to keep your hair colored. It is a personal decision, and now more than ever there are a lot of women coming out and saying the procedures that they have done, which is really great. They're having preventative things done to them, but they're, again, it's not just having healthy skin, right? It's that these stars and celebrities are having work done.
Exactly, because, you know, as we get older, starting at age 25, we start losing 1 teaspoon of volume, and it progresses with every decade. And unfortunately, like I said, gravity takes over. It starts to weigh our face down. The fat pads in the skin start to dissipate, and we just need to sort of replenish that. And I always like to tell my patients, we're not trying to make you look younger, just very, very good for your age.
How come we just can't put the fat where we want it? It's like we want the fat in our face, right?
Yeah, eat a piece of bacon and hope it goes here.
All right. So you actually have an assistant come in with you that helps when you're doing the procedure. So we're going to have her come in, and we're going to show you at home what you can expect if you wanted to get Botox.
Okay, so today we are going to be doing some preventative Botox on Sierra. We are going to be treating her glabellar complex, the lines that can form between the eyebrows. So Sierra, give me a frown line. Perfect, relax. Okay, so Botox is a very, very painless procedure to do. It's just a couple of pokes and no surgery, no downtime. And the results of Botox take anywhere from 3 days to 2 weeks to kick in, and they will last 2 to 4 months. So let's get started. Alcohol swab. I'm just going to clean off the area. Head towards me. Perfect. And the syringe. And then I'll take, okay, frown for me, pull in tight, relax, little poke. Sierra, any pain?
No.
Perfect. Frown, pull in, relax. Relax, good. Perfect. And one more frown, perfect, relax. Poke. Done. Got it, Megan. And that was the procedure of Botox to the glabellar complex for the frown lines.
So that was quick and easy, Sierra, and some of the commonly asked questions we're going to ask you today, because some people like the natural look and some people like the severe look of their eyebrows going, you know, up and down like this. How do you know that on the patient's face? How do you determine that look for them on the person's face?
With experience, obviously, I within the past few years of doing the injectables, you kind of have an idea of how many units you need to inject with every patient's muscle. Now, what I do tell patients, every forehead is different, and the chemistry with the Botox on the patient's forehead is different with every patient. So not everyone requires the same dosing. And what I do like to tell patients is give it 3 days to 2 weeks to fully kick in. And at the 14th day, I will give you a call, see what you think. And if it's not 100% perfect, we bring you back in, and I like to call it airbrushing and perfecting 2 weeks later. We do a little fine tuning.
Well, I want to ask Sierra, did it hurt?
It didn't hurt at all.
Didn't hurt at all.
No.
How about now? Is it tingling you? What's happening?
No, I can't feel it at all.
So you don't even feel like you had anything done. Well, it looks great. And there's just like 2 tiny little bite marks. It looks like 2 little mosquito bites.
Yeah. And those will go away in 15 minutes. She won't look like she had anything done.
Now, those were just getting the lines here done. This is preventative.
Correct.
So if you were on a patient who needed Botox and maybe they were a little older, is that when you go into this line and the hairline, or how does that work?
Correct. If patients do start developing horizontal lines or the lines in the frontalis muscle, the frontalis muscle is the only muscle in the forehead that actually raises the eyebrows. So when we inject Botox up here, it actually pulls the brows down. So what I like to do is treat the glabellar complex, so it kind of gives the eyebrows a little bit of a lift. And when we inject the frontalis, it kind of relaxes, so it's a little bit of a balance, and that's what I like to do.
Well, how long will this last?
So Botox, like I mentioned before, it'll take anywhere from 3 days to 2 weeks to fully kick in, and it'll last 2 to 4 months, depending on how tight, I guess you could say, or how relaxed those muscles are in 2 weeks. If it's not 100% tight and she wants further correction, she can come back in. We could do a little bit more.
And what about if she wanted to get like the sides, and people hear the horror stories of like eye drooping and stuff, so talk about that a little bit.
Correct. So I always tell patients the downtime with Botox, well, there really is no downtime, but we want to make sure they don't lay down for 4 hours, no makeup in this area, no alcohol, no exercise for 24 hours, and just basically baby your face for 24 hours, no heavy rubbing or scrubbing. You don't want to move the Botox into any other muscle in the forehead that could possibly cause an eyelid droop. We go nowhere near those muscles, but like I said, you just want to make sure you're being very, very safe for at least 24 hours after your Botox.
And no cooking, no cleaning, no doing anything like that either. You really have to pamper yourself, right? Get your feet up.
Where can you use Botox on the face?
So on label, dosing for Botox is the upper third of the face. It is the glabellar complex, the frontalis muscle, the horizontal lines, as well as the crow's feet area, the lines around the eyes. Those are on label.
Okay, so that's what you said, on label, which means that's what it has been made for and approved for.
Correct.
Okay, so there are some nightmare stories where people have had Botox injected in other areas which do damage.
There are some off-label dosing areas of the face that we can inject Botox. There are some lower face treatments that can be done with Botox, and we do some of those, and it is very nice. It makes the face very, very smooth, etc. If some patients have sort of involuntary movements of their lower face, maybe some lip lines or in the chin area, we also use Botox for facial slimming, where we give patients a masseter reduction, the chewing muscles in the face. There's a lot of different areas we can inject.
Now we're going to be speaking with an older woman today, more mature, I should say, and we're going to do the lips. So let's talk about some of the other procedures you do before she comes in, as far as what you can do for the cheeks and that sort of thing. What are the other procedures that you do offer?
Some of the other procedures that we do offer is dermal fillers. We use different products. We like to use mostly Juvederm products, and we can inject Juvederm into the cheekbone area for mid-face volume loss. We can also inject the smile lines or nasolabial folds, marionette lines, when patients have volume loss down here. And we inject the lips for lip fullness as well. Now with Sierra, we have previously injected her lips to give her a little bit more volume. However, for our older patients, we would inject the lips for hydration, basically, and just to put volume back into the lips. I like to tell them I'm giving you the lips you had maybe when you were 30 years old, rather than lips when you're 50 years old.
Like Janine, she has these big voluptuous
These
lips
are
that are natural.
Mm-hmm.
All natural.
Your lips, speaking of natural, your lips look very natural. I've seen those lips where the top lip is kind of like hanging over the bottom lip, and maybe that's what girls are going for. I just think it looks kind of silly.
To me, it looks like fish lips, like they're meaning like
That your lips are
and they
out.
look sore. They look sore and swollen.
Yes, and I think that's a big misconception a lot of times with dermal fillers, because when girls think, oh, I'm getting my lips and I don't want to look ducky, I don't want to look overdone. You will never be overdone. I mean, I'm sure that there are some, places that you get injected. Unfortunately, if it's maybe not an experienced injector or someone who's not licensed, and you might get an overdone look, but we're very, very conservative, very natural with our injections, and obviously you can't even tell she has had
And you
anything
can always
done.
get more, so start with less and then add from there.
What would you do if someone came in and said, I want more, and you just weren't really thinking it's good for them? Or did you stop them there, or did you give them what they want?
No, I would definitely stop them there. I will have a detailed consultation conversation with the patient, and that is why I take before and after photos. You know, sometimes I don't just allow them to look in the mirror. I like to take a photo of them and show them what it looks like. Sometimes patients' different perception of their face is different, whether they're looking in the mirror versus looking on a photograph of themselves. And I tell them, you know, this is what I'm going to do. I'll take into consideration what they would like. You know, if they want fuller lips, I'll do it my way, and it always comes out very conservative, very natural, and the patients are usually very satisfied.
Thank you for joining us. Stay with us, because when we come back, we're going to have another procedure done on a little bit more mature face. Stay with the girls.
Hope you guys are having fun with us on The Girls. We are doing some cosmetic procedures here in Scranton, Pennsylvania. And we had preventative cosmetic work done before, and now we're with a more mature patient, right? Mature. Aunt Debbie, right? Is this your Aunt Debbie?
Yes.
Well, it's great to have family on, right?
Oh, yes, definitely. I'm
It
very
looks like
excited.
your mom. You look like your mom.
Yes.
Yeah.
Or sisters, because look at her.
that's true.
I mean, do you want to say how old you are, Deb?
I'm 58.
Well, there you go. You're 58,
you.
and your niece
Thank
has
you.
been doing a great job of maintaining the beauty, because you could tell you're a natural beauty to begin with. So,
Thank you.
Why don't you tell us, you know, what you've been doing here for her?
So on Aunt Deb, we have been restoring volume as well as maintaining the upper third of her face with Botox. Obviously, we like to keep the eyebrows nice and lifted, bright in the eyes. I like to always tell patients, you know, you want to look very well rested, like you just came back from vacation, and obviously she does, you know. We also inject Juvederm into her lateral and medial cheek. It helps to lift the face when gravity unfortunately takes over. And today we are going to be injecting the lower third of her face. We're going to be doing her lips.
Okay, well, we're
Sounds
going
great.
to let you take it away. Are you
Yes.
excited, Deb?
I'm excited.
Have you ever had it done before?
The lower part? No.
Lower part.
No.
Okay, so this will be something
This is
brand new for
something
you
new,
as well.
yes.
All right, well, we're going to let you take it away and do your magic.
So we're going to be injecting Aunt Deb's lips right now. We are going to restore volume. We're not necessarily looking to plump them up, but we're trying to restore volume and add some hydration with some subtle volume. So I'm just going to go and alcohol her lips right now. Now, Debbie has previously been numbed with a topical numbing cream, and we are going to ice her next. My assistant Megan is going to start icing the area that I'm going to begin. And we are using a product called Juvederm Velour. Juvederm Velour lasts anywhere between 12 to 18 months, and it is one of the longer lasting Juvederm products. Okay. And Deb, you doing okay?
I'm good.
Open your mouth a sec. And a little poke, just relax, you're good. And the procedures are almost painless. Little pokes she might feel, but with the topical numbing and the ice, it's very, very comfortable for patients. Open, poke, and I'm just filling up the lips with some filler, adding volume. Doing okay? All right, head towards me. Good, perfect. Open. And little poke, you're okay. Relax. Great. So we're going to continue to inject the right side. Open. And we are looking to do a ratio of 40 to 60, the top lip being 40%, the bottom lip being 60%, because we want to keep a more natural and conservative look when we're doing lips. So we always want to make sure that our bottom lip is definitely bigger than our top lip, because that is the natural look. Open. And as you can see, it's pretty painless. Close. Open. And a little poke right here. Great.
Okay, so I don't know about the viewers, but I'm pretty sure they, like I, when we were watching this, I was sort of like cringing a little bit. So Deb, did it hurt?
Not at all.
Not at all. You
Not
didn't
at
feel
all.
a thing.
No, you feel a needle, but just a tiny little prick, and there's no pain. Yeah.
All right. Well, now we're looking at you immediately after having this procedure. And Amanda, will her lips get larger, or is what we see what we get?
What we see is what we get, Deb. So really, she had hardly any swelling. I really don't anticipate any bruising on her. Usually I can tell pretty quickly if my patients are going to swell and bruise. And there's really no downtime. She wants to make sure that she doesn't put anything on her lips today. We put right now just a little bit of Arnica Montana ointment that kind of seals in the injection marks and helps with bruising and bleeding. But really what you see is what you get.
So she could go out to dinner, she could eat, she could drink, she could do whatever
Exactly.
she wants
She
to
could go
do
to
right
lunch
now.
with her girlfriends, go
They
shopping.
feel absolutely natural and normal.
Oh my gosh, this is amazing.
And what is the exercises afterwards as far as what can she do and can't she do? Because I know you said with Botox there were little limitations.
So really not too much. She just wants to make sure she doesn't eat or drink for maybe about an hour. The lips might still be a little bit of numb because there is lidocaine in the product that we use as well as the topical numbing. Maybe about an hour, just no eating or drinking. But realistically, everything's good. She could go about her normal routine in about an hour.
And this could be done again in like a year to 18 months, you said this should last?
So this particular filler that we used Juvederm Velour, and it does last anywhere between 12 to 18 months. This is a longer lasting filler that we like to use in our patients because if they don't, like to get so many injections, we like to give them a longer lasting filler. However, if patients do prefer a more fuller look and she wanted to add more volume to her patients, she can come back in a month, 2 months, and we can re-inject to make them a little bit bigger.
Okay, do you want to grab that mirror and let her see how she looks?
Oh.
Let's see her reaction. I mean, we're over here going, la, 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 la. What do you think?
Oh, wow. Oh, I love it.
Oh my gosh.
Absolutely.
Is that what you wanted?
Yes.
And how does it make you feel now? Just have
Younger.
that fullness.
Yeah.
Makes
Yes.
you feel younger.
Definitely.
Thank you.
I mean, they look.
Thank
I can't
you.
stop staring at her lips
Thank
now.
You look like sisters. Oh,
Love you.
Oh, beautiful.
your favorite niece, right?
Right.
That's right. So if someone wanted to get information, or how do they start the process if they don't know what they want, but they're looking at their face saying, "Oh, I do look a little tired. I'd like to get some work done." You do consultations.
Yes, we offer free consultations. They just have to contact our office, and the phone number is listed on our website. We also have a couple social media accounts. We have Facebook. We also have Instagram. Instagram is at LMG_Cosmetics, and the Facebook is at LMG Cosmetics. And if you type in a Google search for Botox, our name pops up. So
Good.
yeah.
So you have some before and after pictures on those sites as well that people can
Yes,
see
I
here,
keep a
as
very
well as
large
the people you saw
portfolio.
today. I mean, the amazing
And who
results.
doesn't like selfies? Everyone who has work done takes their selfie and then she can post them for them. And you also do some videos there that are educational.
Exactly. We do like to educate our patients if they have common misconceptions about Botox and fillers, looking unnatural versus looking very, very conservative. So, there's a lot of things on our site. So take a
Yeah,
look.
good. This is like the finale of our season. Yeah, we'll be getting some stuff done as well.
Be coming here for lunch.
How about it? Lunch. All right, girls. Thank you for having us.
Thank you very
Thanks
much for
everybody
coming.
out there for watching, and don't forget you could download our app and you could Google search SSP TV and subscribe to YouTube, and you can watch our shows anywhere, anytime, on any device. So as always, it's been so nice to have you with us. We'll see you next time.